Hey everyone, Dr. Matt Geller here. I'm here with my friend Dr. Laura Periman, ophthalmologist in Seattle, Washington. And I know you're really focused on dry therapies.
Yeah.
We talked on the phone briefly and I had mentioned that I was finding, or when I was practicing, seeing that anxiety and stress was associated with dry eye in some way. And I don't know if there's any literature out there about it, and you kind of nodded to, yeah. You picked up on something there.
Yes.
And I remember Paul Karpecki told me that he was also finding something interesting around that. Can we talk about that?
Sure, the psychology of dry eye.
Yeah.
That's what you're asking about. Yes. Sure. So we're used to thinking about dry as just being this, event on the ocular surface, but you got to remember that there's this constant feedback between the quality of the tears, sensation, the feedback loop through the brain, and the command to the lacrimal gland, the goblet cells, and the meibomian glands. They're under neurobiologic control of the central nervous system. Above that is your ability to cope with it, right? And this is where the psychology of dry eye comes in. And sometimes our dry eye patients are really anxious and frankly angry and frustrated and upset. But when we convey to them, we hear you, we understand, we see what the problem is, we have things to help you. And then they start to see the progress, you'll see these lovely people come out of these frustrated, angry shells.
Yeah.
In our clinic and clinicians, to treat the disease, we try to put the mind at ease. We try to capture them and help them feel cared for, understood, heard, and they have a complete treatment plan. So it all ties back in. This is not in their heads. It's hard to manage chronic pain. We know that from back pain, from post-surgical pain. Chronic pain wears on you psychologically.
Yeah.
Dry eye can wear on you psychologically. So support that whole patient in their recovery.
Because I think pain in some way has to be subjective, right?
Yes.
So it's all of these influences. You've got the things that are happening more quantitatively, but then you have this quality to things. So
Yes.
adding that piece in and being frustrated and upset and anxious does not help your subjective feeling of pain in any way. So that's where the doctor comes in to be conduit to say, it's going to be okay.
Yeah, we
right?
got you.
Yeah,
we got you. One of the other aspects of the central nervous system that we're just beginning to explore is the role of descending pain inhibition pathways, right? Mm-hmm. So that can go offline too, where you're just, the higher processing centers of the brain are not able to dampen the chronic firing of the pain signals from the ocular surface. They're not weak. They don't have bad willpower. That's not it at all.
Yeah.
There's a physiologic, neuropathophysiologic process that happens in some subgroups of dry eye disease.
Yep. Thank you for all the wisdom and for really a different way of seeing things. Appreciate it.
Thank you so much.
Yep.